Hello, we're occupational therapy students from Indiana State University, and today we're doing an instructional video over meal preparation and cleanup for a client with a right CVA. We believe this video will be beneficial for CVA clients, family members, caregivers, and therapists working with these clients.
So just to tell you a little bit about the difference between a right and a left CVA. For a left CVA, the patient will have right hemiplegia, aphasia, either expressive or receptive, and decreased emotional control. For the right CVA, which is the one that we're discussing today, they will have left hemiplegia, left neglect, impulsive, decreased executive function, good verbal skills, decreased awareness, and they'll be more sensitive and they'll experience more pain.
So we're going to do our video through an example case study. We'll go ahead and read that to you, and then we'll be treating based on this case study. So Marge is a 70-year-old female. 8 weeks ago, she experienced a right CVA, which resulted in left hemiplegia, left neglect, decreased executive function, and decreased awareness. She spent the first 2 weeks in an acute care hospital and then an additional 6 weeks in a rehab hospital. She has now been discharged to go home. Prior medical history includes hypertension and type 1 diabetes.
Marge also has 2 sons who are grown and they live nearby. They're busy with their own families and they're not used to seeing Marge very often, just about once a week. She's retired from a career as a teacher. She lives on her own in a ranch-style home. Prior to her stroke, Marge was independent in self-care activities, meal preparation, and she was very social. She fears that she'll not be able to take care of herself and she may end up in a nursing home.
Marge was referred to home health services for occupational therapy by the rehab hospital. During the initial occupational therapy evaluation, the OT noticed that Marge presented with decreased awareness and left neglect, making her unsafe in the kitchen alone. Her executive function limited sequencing during meal preparation. Marge transfers and ambulates at a level of modified independence with the use of a quad cane. She is also dependent on her sons for instrumental activities of daily living, such as shopping, laundry, and bill management, as well as meal preparation and cleanup. Marge expressed the goal of preparing meals independently in order to take some of the caregiver burden away from her sons.
So with the pre-instructional assignments, we recommend that the client wear tighter clothing just so it doesn't get caught in like the stove and things. Definitely have a gait belt on them at all times. Make sure you have their mobility devices and adaptive equipment ready before you start meal prep.
Okay, and then we're going to go over the learning objectives for this video. The first one is that the participant will learn compensatory strategies for meal preparation and cleanup using assistive devices for CVA clients.
The second learning objective is that the participant will learn energy conservation techniques for meal preparation and cleanup, as well as how to teach those strategies to a client that has experienced a CVA.
Our third learning objective is that the participant will demonstrate an understanding of safety precautions associated with meal prep and cleanup relative to those who have experienced a CVA.
Number 4 is the participant will be knowledgeable about potential environmental adaptations that are relevant to those who have experienced a CVA.
The fifth learning objective is that the participant will learn work simplification strategies to incorporate into meal prep and cleanup with the CVA client.
Number 6 is that a participant will be able to list the characteristics that are associated with a left and a right CVA.
Hi Marge, how are you doing today?
Good.
We're going to work on some simple meal preparation, making a soup and salad. How does that sound?
Sounds great.
Okay. First, I need you to make sure your brakes are locked every time before we get up. Good. You knew where that handle was. That's good. Okay, now we're going to put this on for safety, and you use the quad cane to get around, is that right?
Mm-hmm.
Okay. Make sure we have this on. Have you been able to prepare any meals by yourself at all?
No.
Nothing? Okay. Your sons help you, is that right?
Yep.
Okay. And how often do they come?
About once a week.
Once a week. Okay. Who helps you when they're not around?
I either have a caregiver or I attempt to do it myself. Usually doesn't work.
Yeah, we're going to see how safe you are today in the kitchen. Okay. Alright, I'm just going to move this out of the way for us. And what would be the first thing you need to do to make soup and salad?
Get my food.
Yeah, let's go ahead and get everything that you need. Uh-oh. Okay, so when that happens, we have a handy little tool called a reacher. So instead of bending down, which could lead to a fall, I want you to use that reacher to grab the spoon. All right, good. We can clean that off later. And a stroke patient may or may not be able to find all of these things in the fridge. She would probably have some left side neglect, so teaching them to be able to look all the way to the left and then all the way back to the right to incorporate visual scanning would be a good thing to do here. So. Looks like we have everything for the salad. And then we have here just a rolling table that she can put everything she needs on it and push as she goes to the next station.
Yeah, sure.
So you want to make sure that there's a clear area in the kitchen, nothing that they're going to trip over or run into, especially with that left side neglect. And she has pretty good balance with the modified independence with the quad cane, so she can get around pretty well with that. Okay, now we're going to start cooking the soup. What else do you need?
I'm not sure.
Okay, so we need something to stir the soup. Good. And then we have some bowls up here to put it in. You may need something for your salad as well. Good. I would have made note if she forgot to close the door or had any other safety issues. It's always good to use white or light colored dishes on dark surfaces so that they can see it better, because she also has visual impairments as well. Okay, so what are we going to do next? Okay. You can also use sequencing boards or task boards to help them. Once you figure out what they're having problems with, you could post the board up here by the stove just to see what they need to do next. So you can put that on this little non-stick Dyson. We can put the soup on there, and that will make it easier, hopefully, for you to open with the one hand. This has a pull tab. You can also use these can openers that are squeeze, or electric can opener. Get it? You can place your other hand up there, like your other arm. You can pick it up for me. Yeah. And kind of use it to hold it or just stabilize yourself. Here you go. You always want to make sure that you can incorporate that affected arm and hand as much as possible to get return from that. There's also all kinds of equipment you can use with CVA patients, all kinds of adaptive equipment. With this, we don't have it with us today, but you could use a pot holder that sticks to the stove and holds the handle of the pot so she can stir with one hand. Okay, what's the next step? We want to turn this burner on right here. Can you find it on the stove for me? Okay. That is actually this one. So, I know. Don't touch the stove. So she's basically, she can't see to that left side. So what I'm going to do is provide an anchor for her. So can you look all the way to your left, turn your head until you can see that blue box of Rice Krispies. Can you see it? Okay, now can you see the knob next to that? That's the one we need to turn on. So having something on that left side for them to anchor to find relation to what they need to go all the way over to that left side. You can also use the lighthouse method and teaching them to scan like a lighthouse all the way to one side and all the way to the other to find the ships at sea. That's also another method you could use. Okay? Now we're ready. Put the soup in. And we're using work simplification. She may be used to making vegetable soup by cutting up everything, but this, having it in a can, it may not taste as good for her, but at least she can fix a simple meal instead of taking all the time and cutting up all the vegetables and all that. So this is a form of work simplification. Okay? Good. Okay. You feel like you need to rest a bit? Okay. We do have the wheelchair behind her if she feels that she does need to rest. So that would be a form of energy conservation, being able to just sit and take breaks. Everything's on now. The soup is cooking, and she could just sit back and take a little break before she went to the salad. So that's our next step. So this is also working, not only working on sequencing, but multitasking and safety awareness of that left side. Now remember, you can use that left hand to stabilize yourself, to kind of lean on it. That'll also provide some weight bearing through that arm, which is really good to incorporate. Another strategy you can use with a patient with a CVA is hand over hand. So she's going to need some help opening this package. She has pretty good balance, so we want to incorporate this left hand. So I'm just going to help her try and grab this here. There you go. Pull it apart. Kind of keep hold of this with this hand while you grab some of those out of there. And we're also, because we're doing a task-specific approach, this is going to carry over better after treatment. So she's actually doing something related to what she will be doing at home in the future. Okay, I'm going to put those back over there. There we go. Again with this one, as much as you can incorporate bilateral integration by using both hands at midline, that is also something great to use in your intervention. Okay, let's hold it with this hand and try and unscrew with this hand. See, she's already compensating by turning the bottle. So if that works, that's fine. We're still using the left hand. So if that's how they can do it, then that's a great way to use it. And I'm always keeping her hand down here. So she's aware of it at that midline. That's going to be able to help her to see it better and incorporate it more into the task. All right. Looks like a pretty good salad. Do you need something to eat it with? You're going to have more success, obviously, in their own kitchen, just because they know where everything is. They may become more frustrated if you're in the therapy gym or somewhere where they're not an unfamiliar environment. Okay, I would go ahead and put that back on your table. So that's one less step you have to do. Just your salad. Actually, yeah, let's go ahead and put everything on there. We can make a trip to the fridge. Still feeling okay?
Mm-hmm.
Need to sit down at all?
Mm-mm.
Okay. How's your soup looking? Repetitive tasks are also shown to increase ability with that upper extremity. So I'm going to have you hold on to your cane here with that right hand, and let's do some stirring with this left extremity. So there we go. Just the repetitive task of stirring is going to help her create a movement pattern and kind of ingrain that for this upper extremity. We'll go both ways. Good. We've got it on medium heat, so she knew not to turn it too high, which is good. I'll let you put that back. Okay. All right. All right, so we are going to take our salad over to the table to eat, and the fridge is on the way, so we will simplify our task by not making multiple trips and just putting the food away as we go. Okay? And the whole time we have the chair here just in case she needs to take a rest break or sit down at all. Okay, now we need to take our salad over to the table to eat. We'll put away the ingredients after that. This is just a bedside table that you could get at a local pharmacy store. I know that you can rent them pretty inexpensively, so that would be an option for your patient with CVA, who has had a CVA, sorry. Another strategy that you can use with these patients are to adapt the environment. So we can place all of her ingredients that she's going to use up at a higher level, as well as putting the pots and pans and different utensils that she's going to use at a level that she can reach. We may also incorporate strategies if she likes to use different recipes. We could make a larger print cookbook for her to cook out of in order to see that better. Still doing okay?
Mm-hmm.
Sorry. Getting in your way. You don't need to take a break or anything? Okay. So now we need to check how that soup is doing and kind of clean up as we go. Another example of adapting the environment is having the trash cans close to where she's going to be able to reach them easily. Okay, do you think your soup is done?
I'm not sure.
Okay, so if they can't tell different things, like if if something's hot or cold. You can teach them to use other strategies. So do you see any steam on there?
Mhm.
Okay, so that probably means that it's hot enough, but maybe a little too hot to eat. So let's go ahead and turn the stove off. Remember that technique I taught you? Good. So she looked all the way over to the cereal box to see that knob to turn it off. All right, what do we need to get that out of there? That was good. Good problem solving by turning the pot around. She didn't choose the best tool to use. There's some bigger ladles over here, so I think this might work a little bit better for you. Think that's enough?
Mhm.
Okay. All right, so we are going to get our table. Remember where you left it? And I'm always right here, just in case she were to trip on something or fall. Okay, and let's go ahead and take everything with us. So we can make one trip over to the sink. The pot's probably too hot right now. We'll get that later, but the less trips we can make, the better for energy conservation. And I'm going to go ahead and bring this with us too. That might help this bowl stay on here a little bit better. Okay. Do you need something to eat your soup with?
Mhm.
So at the beginning, it will probably be a lot of cueing and a lot of reminding. You want to also make sure that they have some success so they don't feel like the session is a total failure. Right, and you didn't see, but she already put the spoons in the sink, so she needs to do that. And then we are going to take our soup over to the table with the salad to eat.
All right, so we switched roles for the cleanup portion of this. So we're going to have our client stand up. And we're going to have her take her dirty dishes when she was done eating. So now we're going to have her take her dirty dishes to the sink. She's going to use her tray again. Okay, so we're going to have her dishes on her left side, so she has to reach across and look at the her left neglect so that she can reach across and put them in the dish or in the sink and rinse them off. And don't forget your pot that we left on the stove over there. Okay. Now that she let it cool off, she can bring it over and wash it. So it's important for them to test the water before, since someone with a right CVA will have more sensitivity than normal. So it's important for them to test the water so that they don't burn themselves. And we're going to have her use this left arm to stabilize herself and put some weight bearing into that affected arm. So we're having her rinse these out and then put them in the dishwasher. This is an easier way for her to do her dishes and not have to spend the time standing at the sink. So it's an energy conservation. Okay. So she's going to put things on the top rack so that she doesn't have to bend all the way down and risk losing her balance. So we've been doing countertop activities so that she can work on her balance, but if she couldn't do that, we could have her do most of these activities sitting down. So then that would save her energy also.
Should I wash this by hand?
No. You can put it in there. Okay. And that's preference by the person also. Do you normally wash your pots and pans?
Mm-hmm.
Do you want to wash your pot?
Sure.
Okay.
I think it takes the coating off, maybe. I don't know.
So with the water also, you can have somebody set your water heater at a lower temp so that they can't get to those higher temperatures and potentially burn themselves.
Crossing midline is really good.
Yes, crossing midline is good for them to remember that that left side is there, because a lot of times they'll forget about it. We want to try and stabilize this with this hand. So it's really good to do some hand over hand movements. So we can have her hold on to this pot with her left hand and she can scrub with her right.
Both hands.
Yep. And you can use both hands to turn it over. If the pot were to be too heavy for her to do so. Okay. Alright. And set that in the dish.
Yeah.
Reach over. Okay. Okay, are we done?
Okay, now that we've gone over our case study, we'd like to go through the intervention approaches that we used. We first used sequencing by going through each task. The soup and the salad were both a sequence task, so this evaluated her ability to be able to complete those. We also used multitasking by having her do the soup and the salad at the same time. She had to go back and check the soup. So this was a good evaluation of multitasking. Safety awareness was evaluated as she had to use the stove, manage the hot water, and pay attention to drawers and doors, being able to shut those, and pay attention to things that may have been in her way, tables or anything on the floor. We also used upper extremity weight bearing for stabilization to incorporate sensation and to stabilize her during the task so that she had something to stir with the other hand. We also used a Falter's approach, which refers to hand over hand, the therapist using the hand over hand approach with the client. So that was used during the stirring of the soup and opening the bag of the croutons and the dressing.
We also, we could have used cognitive strategies like errorless learning or timed retrieval, which are used to teach a client how to use their adaptive equipment, or just any compensatory strategies that we would have given her. We did a task-specific approach, which is something that you would use. It's like an everyday task that she had to do. So she'd be cooking a meal every day, so this was task-specific to her. We did it in a familiar environment. We could have done it in her home or at a therapy center. It's better to do it inside their home so that they're used to where everything is at. We also used bilateral integration. When we were washing the pot, we used both hands to turn it, to wash it. We also used both hands when opening the croutons and the dressing to incorporate both sides together and the loss of the upper extremity.
Going off of that, bilateral integration incorporated working at midline. So she was working at midline when she opened the croutons, the ranch dressing, different things, just bringing more awareness to that left side. We also incorporated trunk rotation, which is very important for clients who have had a CVA, as they don't have great posturing and positioning. This was done when we transferred items from the table to the counter, and then we also used the repetitive tasks when stirring, once with the left hand and the right hand, just to incorporate that movement again.
We did standing tolerance and balance during both the washing, the cleanup, and the task. The client was standing the entire time and balancing while she was grabbing different items. We did verbal cues. This is very important for a person with CVA because they are very likely to need verbal cues, especially at the beginning. And then we also incorporated PNF patterns, which is whenever they reach in diagonal patterns. This is just a functional range of motion task. Instead of doing just in one plane, this assesses several different planes.
Okay. Now we'd like to go over how we've addressed our different learning objectives for this video. The first one was over compensatory strategies. So compensatory strategies include the self-stabilization when she put the affected upper extremity up on the counter to stabilize herself. Another compensatory strategy was the self-hand-over-hand technique when she picked up the pot to wash it using the right hand over the left. Also, visual scanning techniques are a compensatory strategy. So this includes the anchoring when the therapist had her look at the cereal box to find the knob on the stove. And then as well as we had mentioned the lighthouse method, scanning from side to side, looking for the ships at sea. We also mentioned a visual sequencing board, which could be used as a compensatory strategy, and this would include pictures and words in a specific sequence if the client was having trouble ordering these things as she was making the meal. Also, sensory compensation was used as she could not tell if the soup was hot, so the therapist suggested looking to see if she could see the steam rising from the soup.
Our second learning objective looked at the adaptive equipment that we had our client use. We had her use a reacher to grab the utensil off the floor instead of having to bend over. This becomes difficult with clients with the CVA. They usually have limited balance. We showed the squeeze and the electric can opener. Since that can had a tab lid, it wasn't necessary. But for cans that don't have that, these other two items are helpful. We explained the pot holder also. This is it's a two-prong piece that just sets on the stove to help hold the pot in place, so you can stir with one hand rather than two. We also used the non-stick mat that helped keep the plates stabilized. And then we also mentioned a large print cookbook for visual deficits.
Another learning objective that we addressed was energy conservation techniques. These included the client sitting between tasks. The therapist continually asked if the client was feeling okay, if she needed a rest break. So if she had needed to, we had the chair closed so that she could sit at any time. For example, after she had started the soup, she could have rested for a while before beginning with the salad. Even though the client didn't need to, we could have had her sit at a table while making the salad just to conserve more energy if needed. Also, we made sure that she made the least amount of trips as possible. So, for example, taking all of the dishes over to the sink at once and taking the ingredients to the fridge with her on the way to the table to put those away.
Our fourth one was safety precautions. We explained how you could adjust the hot water temperature on the water heater, or have them just kind of put a finger or two under the water just to test it to make sure it's not too hot before they start to wash the dishes. And we also talked about decluttering the area to make it a safe area for them when they're walking, so that there's not tables in the way or anything that they could trip or fall on.
Another learning objective that we addressed was environmental adaptations. We have mentioned to move items to frequently used items to an easy to reach location, so that she's not bending down and leading to a fall. And we should have done this with the pots and also some of the food in the fridge. We should have moved that to an easier to reach location so that she didn't have to bend down. We also mentioned using light colored dishes on a dark background for the cabinets and the countertops, just to make higher contrast so that she could see these better. You could also do this with foods in the fridge and different things like that. Also, another environmental adaptation is to move items like the trash can to the workstation so that she's not going back and forth and can have everything there in one location.
Okay, and our next learning objective was work simplification. So we mentioned that we could have used fresh vegetables instead of the canned vegetables, but it's a lot easier and it just simplifies the task for the client if they are okay with using canned vegetables. We also we use the dishwasher instead of actually washing all of the dishes. This is also, it just makes the task a little bit more simple for the person. But if they do wish to do it the other way, then that is what we would do. But for this task, we simplified it for them.
Okay, and just a few reminders. Remember to always use a gait belt with your client for safety. Even though we were just standing right there by her, she could pretty much do everything herself with her quad cane. Just have that gait belt on for safety. Also use their own mobility device because that's what they're used to and that's what they're going to perform better with. Also allow them to try to perform the task themselves before you actually intervene and suggest an alternative to the task.
It's also important to remember what to look for during an intervention or an evaluation with a CVA client. It's important to look for executive functions to see whether they can or cannot perform those, problem-solving strategies, safety awareness, and body awareness.
Okay, and we want to thank you for watching our video. We have a few questions for you to answer at the end. Thank you.